Welcome to General Herbals Limited, the manufacturers of Covidex and other natural products. I am Professor Ogwang Patrick Engeu, the Chairman and Managing Director of General Herbals Limited. With me is
Dr Lillian Ogwang. I'm a Director at General Herbals Uganda Limited, in charge of research and innovation. You are most welcome.
So today we are here to share with you about sickle cell disease. So what is sickle cell disease?
Thank you. So sickle cell disease is a genetic disease, and it is a disease that affects red blood cells. So what happens in sickle cell disease is that there are abnormal red blood cells. They lose their shape and are destroyed quickly, faster than normal red blood cells. So when someone has this problem, then they'll present in a certain way that we shall talk about. But that is sickle cell disease.
So genetic means that you inherit it. It is in the genes, not witchcraft, not your neighbor, but it's in the genes from your mom and dad. So how does one get sickle cell disease?
One will get sickle cell disease when a parent has one of the genes that causes sickle cell disease, and another parent also has that same gene. There is a chance that when they have children, they can have normal children, they can have children who will just carry the gene, but they can also have a child who will carry both genes and end up getting sickle cell anemia.
So this is important, that for somebody to get a child with sickle cell, both parents contribute. Both parents contribute the genes for a person to become sickle cell, but not the mother only, but both daddy and mommy contribute. And the chance is 25% of getting a child with sickle cell disease. Not as you can get a child who is totally normal, the chance is 25%. The child who is a carrier, the chance is 50%. And a child with sickle cell, the chance is 25%. So after that, how can you know that somebody has sickle cell disease?
Yes. So first I would like to say that in the general population, when someone has sickle cell disease, usually the general population is talking about those who have sickle cell anemia. Those who are also carriers are not in the general population said to have disease, but in the medical field we consider them as having disease. But now we are going to talk about those who have the sickle cell anemia. In sickle cell anemia, you find children.
Even adults.
In sickle cell anemia, people who have this condition have mainly a problem with blood, so they get anemic. They also commonly have infection, and they also have pain. All these can be to different extents for different people. So anemia is because the red blood cells break down quickly. Infections are because during the early childhood, their spleen gets damaged by these red blood cells which are in the vessels of one of the organs called the spleen. The spleen helps to fight infections, but if it is damaged in early childhood among people with sickle cell anemia, then they cannot easily fight infections. Then the pain is because the red blood cells have abnormal shape. So in the blood vessels, they tend to not move easily. They block the blood vessels and cause this pain. We can talk about many complications of sickle cell anemia, but those are the common ones that we deal with.
So usually, when somebody is born, they may not know at that early stage that a child has sickle cell disease, or anemia she's calling it. But from the age of usually 6 months, they may start to show some signs. For example, pain, frequent pain, or swelling of fingers. And also because in the early stage, I think the first 6 months, the red blood cell, as she has explained, is the same for all people. It's called fetal hemoglobin. Hemoglobin for for infants, I think, those below 6 months. And from 6 months onwards, it changes to adult hemoglobin, kind of. That's when the difference begins to be seen. But through screening, laboratory screening, you can know early if somebody is carrying the sickle cell gene or has the 2 genes which can become a disease. So, can sickle cell disease be cured?
So sickle cell disease, currently we have no cure. Research is ongoing on how there could be some possibilities, but currently we do not have a cure that makes someone completely free. There is some work which can help, there's some work that's going on that can help for the patients of sickle cell disease to live a normal life, even though they may still have sickle cell disease. But it is quite an intense treatment option and has many complications, so it is currently not commonly recommended.
So what we know right now is that sickle cell cannot be cured by any medicine so far. There are other new technologies that are being introduced called gene therapy, are not yet widely available, and their effectiveness is not yet fully confirmed. But there is great hope that in a few years from now, we are most likely to have a cure of sickle cell developed by scientists in many parts of the world. So how does one prevent themselves from getting or producing a child with sickle cell disease?
So in the aspect of prevention, it is key that we know our status. Here I mean we should know whether we are having the gene that causes sickle cell disease or not. There are ways that we can check in the lab whether one has that gene or not. So it is a very simple test, and we encourage all parents to check for this gene. This is really what we call sickle cell screening. This is very important for every couple who is planning to have a child. But we still advise that this test or this screening is done early in life, because sometimes it's when they're adults we may not plan but still have children, and then we may realize later. And sometimes people may lack information, and yet we can actually do screening earlier in childhood, counsel our children when we find that they may be carriers, so that they prevent themselves from having children with sickle cell disease.
So the best way is, before you marry, before you choose a partner, first go and screen yourself and find out if you're a carrier or you're normal. Such that in case you decide to get a partner to marry and get children with, you also ask her or him, are you a carrier or not? So that a carrier does not marry a carrier. That's the best way to prevent. But as she also explained, even for us who are parents, let us take our children for screening so that they grow knowing that I am a carrier or I am normal. That will help them to choose a partner who is not a carrier. That way, we can actually eliminate sickle cell from the world. If we all know our status and we marry the right person regarding that status, then we cannot have any more sickle cell children being produced.
We would also like to demystify the fears that come with one knowing about their status in regard to sickle cell. Some people feel condemned because of knowing their status, but it is actually better to know so that you can prevent having